Let's be honest, going to the doctor's office takes time, copays, things of that nature. So one of the most common questions I get in the emails is, are there any home remedies for heel pain? And the answer is yes, because the number one treatment is rest. This is a true injury. So the bottom of the heel for sure. Again, the heel pain on the back, which is the Achilles insertion, where the Achilles tendon attaches, that's a little bit more serious, but that too can heal with rest. There are other things that patients can do at home. Are arch supports over the counters can work. Slight heel, obviously you elevate the heel and you go into the ball of the foot, you'll have most of the pressure here and elevate it from the heel. And that works best for people whose feet flatten, or what we call pronators, where they flatten and push out this way. And running shoes are a lot better than flat shoes or shoes without an arch, or hard flip-flops, bare feet, house shoes, sandals. So if you can abstain from that and rest, stay in your running shoes or a slight heel, maybe a Western boot for my guys, unless you like to wear stilettos, that works fine too. Otherwise, my ladies do have more options, a wedge, stretching. That helps out too. Now you would think this is trying to heal, so you don't want to stretch this ligament and really rest it. But if you put both hands against the wall and you do the Achilles stretch with one leg back, and you're not violently, pushing that thing down, and just a nice static stretch, 30 seconds for one side, 30 seconds for the other side, every morning and every night, those patients usually do the best. And speaking of static stretch, there are those night splints. And basically it's just a splint that goes down the back of your leg, pushes your foot up where the plantar fasciitis is, and it holds it in that position. So it can keep a static stretch on it for folks whose feet come down in the evening and the covers push the top down and the ligament shrinks up, so you don't have that violent pulling back every morning. But I caution you, they work okay, but mainly it's rest, so they're not magic. You can also, one of my patients said she had a tube sock and she pulled the end down and put it up and actually stapled it to the top. So you can make your home brand, or MacGyver it, as we call it. But as long as you rest it, keep stretching, proper shoes, most of these plantar fasciitis cases just go away on their own.